Montana, Mr. Daines.
Thank you, Mr. Chairman. In February, I had the true privilege of presenting the Defense of Freedom Medal to a great Montana resident named Richard Zielinski. Richard was one of the more than 200,000 patient movements since 9/11, and he spoke highly of the outstanding treatment received in the center, received in the theater, during his transport, and at Landstuhl Regional Medical Center. Lieutenant General Travis, on behalf of Richard, a resident of Stevensville, Montana, I want to thank you and your team for the professionalism and the dedication they give day in and day out, be here at home or in the most dangerous parts of the world, to keep our men and women ready to serve our country at a moment's notice. I'd also like to extend those thanks to all the fine folks sitting here. Oftentimes you come to the Hill, you don't get much of a thank you, but when you put it on the face of those men and women that you serve, you know it's worth it. So thank you, along with those who are serving out in the field that may not always get the thanks they truly deserve. Mr. Miller, a question. As the DoD healthcare management system has worked to improve information between the VA and the DoD, have these efforts led to a measurable improvement in the healthcare our servicemen and women receive?
Sir, I think one of the things we're working through right now is really understanding what our outcomes are. And so we have agreed to specific use cases that the DoD and the VA are looking at and are actually starting to look at our measurements and how we're doing. But I would offer, sir, I view success really from the people that are using the system. And I go around a lot, and I talk to a lot of people, and I would tell you today that I can put VA clinicians and DoD clinicians in the room, and we're actually now talking about looking at the same information. We're actually able to access that information, and we're able to improve the timeliness that it takes to do things, whether on the clinical side or on the VBA side, by the tools that we have provided over the past 18 months. We are talking about metrics. We are looking at how we share information. But I think ultimately success here is really whether or not our clinicians and the VBA claims adjudicators can get their job done, and that's who I'm listening to right now, sir.
What do you think? I spent 28 years in business, and there's an old saying, if you aim at nothing, you'll probably hit it. And as you think about it's a complex system, but I know the role of leadership is to try to say something very complicated, distill it down to the most important elements to measure those things that have the greatest leverage and ensure that really connect to how you define quality of care and outcomes. What are 2 or 3 of those metrics as you are looking at that process that you think we ought to be focused on and measuring success?
Yes, sir. So a couple of things that we're looking at right now. One is what percentage of our records are correlated, which basically means whether or not I can electronically send the information from the DoD and the VA, and we can access it in real time. And we are doing things there to make sure that information and that number continues to arise. We're also looking at how much the people are actually using the system. I think one of the challenges with these complex systems is whether or not the people actually understand that some of this information is available, how do you get access to it? And so we're looking at that kind of information. The other piece I'd remind everybody is we talk a lot about DoD VA. Well, the reality is 60% of our care on the DoD side comes from the private sector. And so if we really want to understand the integrated health of what's really going on, you have to tackle that problem. And this is a much bigger national issue, but we're involved and we're looking at how much we're able to start pulling that information in so that when we're looking at it, we really truly have the complete picture and our clinicians can make the best decision no matter where that care is being provided.
And then how much of the voice of the veteran in that process is part of that metric in terms of a survey going directly to the customer, if you will, in this?
So right now, sir, we actually, both the VA and the DoD is going through an assessment process to really understand how well our systems are working. You know, one of the things I've brought into this process is a real structured discipline. And one of the things you do in this manner is you really go through a testing and evaluation phase. So the VA, under their Veterans Health Administration, is doing a formal survey of their users to include the different areas. And they're going to bring those results back and share that with us. And then on the DoD side, the Director of Operational Test and Evaluation and the Army Test and Evaluation Command, they are also going through a test process for us that will start here in April. And we're going to take those results, and then we are going to basically put them on the table and talk about what we have to do to further improve.
Mr. Miller, thank you. One last question before I run out of time. We've seen the very disturbing news this last week about personal information. A system compromised here of of our men and women who wear the uniform. What steps have you taken to ensure the privacy of our servicemen and women as this information gets shared between agencies?
So I would offer that the protection of information is obviously a challenging and I think growing threat. And I think, on our side, what we're doing is that we look to the future is, if you look at our requests from industry, you are going to see some very rigid and challenging security things that we're asking for. Obviously, there are rules like HIPAA and our own security, but we're also going a step further and really asking to see things like the source code and really trying to understand how secure the systems are so that we can do everything possible to protect that information, because it is valuable information and sensitive. And so we are bringing in some real information assurance experts as part of our team to make sure we do this right.
Well, and I just as a closing comment, we've heard a lot of concerns from our veterans on this and our men and women who are serving, and they are worried now, will my family's information not be accessible to other folks who would be a significant threat to our country, and we must do everything possible to ensure we protect the privacy and information of our men and women who wear the uniform. Thank you.
Yes, sir.